An acupuncture needle has been used to relieve pain and achieve anesthesia. Surprisingly, acupuncture anesthesia dates back to the 2nd century BC.
The most basic form of treatment in Oriental medicine is acupuncture. Acupuncture not only alleviates pain, but also has an anesthetic function. We'll take a look at acupuncture anesthesia in today's segment of Oriental Medical Digest.
Anesthesia and analgesic used in the external surgery are carefully selected based on the condition of a patient. If a patient has hypertension, hypotension, high fever, or allergy to anesthetics, the risk of danger increases.
The theory behind how acupuncture anesthesia works is explained in two ways. Explanation in terms of Oriental medicine is of stimulating the flow of qi and blood circulation to suppress the pain while receiving surgery. Western medicine explains the effects of acupuncture anesthesia as blocking the nerve passage, which transmits the pain perception, and stimulating the endocrine system to release the hormones such as endorphin and enkephalin.
In order to find the effects of acupuncture anesthesia, we visited a laboratory.
This experiment is to examine how anesthetized rats respond to the electric shock engaged on the lower abdomen. This point is comparable to hapgok of the human body. It's located between the thumb and index finger at the angle of metacarpals. First, stimulation is done without anesthesia. Let's stimulate again after the insertion of a needle. The graph on the left indicates the pain level without anesthesia, and the right graph indicates the pain level with anesthesia. As you can see, the amplitude is much higher in the left graph, as the rat experienced much severe pain compared to the right graph.
Principle of acupuncture anesthesia is based on the fact that the acupuncture has an effect to relieve pain. Acupuncture not only invigorates the flow of obstructed qi, but also promotes blood circulation. Our next experiment is to see how acupuncture can give a change in blood circulation. The ITI examination is done to determine the status of a blood circulation before the acupuncture needles were applied. The ITI is a device to measure the body temperature using an infrared light. Infrared emitted from the body is detected by the DITI to correctly diagnose patient's body temperature. Patient is required to undress completely and wait for 10 minutes as the body temperature adjusts to the room temperature. This process can minimize the measuring error. The ITI measurement is displayed different colors for an easier observation.
이것이 전면 사진인데요. 전면에서 봤을 때는
This bluish region in the first picture indicates low temperature because of insufficient circulation of qi and blood around the hip joint.
쪽보다 많이 분포되어 있기 때문에 지금 옆에
After the acupuncture treatment, DITI analysis shows even distribution of the temperature on both sides.
보입니다. 그래서
신마취가 여러 가지 어떤 장점을 가지고 있음에도 불구하고
Acupuncture anesthesia has many beneficial merits, but it still poses problems to be applied in internal surgery. Nonetheless, acupuncture anesthesia is quite effective for endoidectomy, thyroid surgery, gynecological abrasion, and so on.
어떤 소파 수술 같은 데는 우리가 임상에 얼마든지 활용을 할 수가 있겠습니다.
We have examined the acupuncture's analgesic function so far. Now let's find out whether acupuncture can be used as an anesthetic tool for the external surgeries. Let's take a look in the gynecology operation room.
The third experiment is for the acupuncture anesthesia used in the gynecological surgery.
먼저
To engage acupuncture anesthesia for abrasion surgery, a needle is inserted on the joksamri, which is approximately 5 centimeters below the lateral patellar border. Another needle is inserted near the joksamri to give an electrostimulation. Samunkyo, about 5 centimeters above the medial malleolus, is a common anesthetic point for the perineal section.
회음을 절개하는 경우가 많은데요. 그 회음 절개할 적에 많이 쓰는 침 마취혈이 되겠습니다. 마지막으로 근문혈에 침을 놓게 되는데요. 근문혈은
Lastly, kumun, 2 centimeters below the external malleolus, is an excellent point to prevent acute hypogastric pain during gynecological surgeries.
이곳에 침을 놔서 그 침 마취를 시키는 이유는 자궁 내막 소파 설계골라 3촌에
Acupuncture anesthesia is based on the theory of stimulating the meridian to promote the analgesic function. All these points are simultaneously needled on the opposite leg. Uterine abrasion is done in the case of malformed fetus or when the mother's life is at risk. Once all the points are needled, then samumgyo and kummun are connected together, and joksamri is connected to the adjacent point by an electrical wire. Slight twitch is a normal reaction when the electroacupuncture is applied.
생각보다 아프지 않았고요. 마취 후에 마취가 들깨서 몽롱한 상태에 그런 게 없어서 좋았습니다.
21분 중에서 18분은 마취제를
From the
쓰지
clinical
않고
experience, 18 out of 21 patients didn't feel much pain.
3명의 환자는
The remaining 3 patients were given conventional anesthesia during the surgery, and half the dosage was adequate enough to achieve full anesthesia. Therefore, patients experiencing hypertension, hypotension, high fever, or allergic reaction to anesthesia will especially benefit from this anesthetic treatment.
무난히 끝낼 수가 있습니다.
The history of Oriental medicine runs parallel to the history of Korea. Thus, it is not surprising to see the treatment technique exists for every diseases. Above concept also applies to analgesia and anesthesia. Acupuncture anesthesia used to deliver a child and treating emergency patients are few of the basic tasks of Oriental medicine. Thank you for joining us today. I'll see you again next time.